Hi guys, are you a doctor or a nurse? Great job, keep watching. Wait. If you're not a doctor or a nurse, still keep watching because I have some really good news. So, apart from tech, there is one more sector that is often hiring and offers a lot of visa sponsorships for jobs in the UK, and that sector is tech. No, it's not. I'm just checking if you're paying close attention. That sector is not tech, we all know that. That sector is health and care. And we're talking about health and care visas in particular. Now, here's the thing, if you're not a doctor or a nurse or a healthcare professional, you're probably wondering if you can even move to the UK with this visa or if this video is useful for you or not. The good news is you can move to the UK under this visa even if you are not a doctor or a nurse or a healthcare professional. So in today's video, I'm going to be sharing all the details you need to know to get a health and care worker visa to move to the UK. So remember to watch all the way till the end. On this channel, we talk about how you can move to the UK whether you are an individual working professional, a student, or a dependent, and sometimes we crack really bad jokes. It's all a part of the package. If you haven't hit that subscribe button, I don't even know what you're waiting for. Hit it now and click on the bell icon for notifications. Now, what is the Health and Care Worker Visa? So, the Health and Care Worker Visa is a relatively new category that was created for professionals in the healthcare industry from overseas, that is not from the UK, and people who are going to come work for the NHS or one of the NHS supplied contractors or in adult social health care. This category was created to make it cheaper, quicker, and easier for healthcare professionals from around the world to come work in the UK. The Health and Care Worker Visa is open to qualified doctors, nurses, and other health and adult social care professionals who wish to undertake the eligible job with the NHS or in adult social care. The Health and Care Worker Visa can lead to settlement in the UK after 5 years, and applicants are allowed to be joined by their dependent partners and children. The good thing about this visa is that holders pay reduced visa fees and do not need to pay any immigration health surcharge. Now, if you're neither a doctor nor a nurse or a healthcare professional, you can still move to the UK if you are a care worker. Now, the concept of a care worker is really simple, and this is the golden ticket to the UK that I was talking about. Now, if you are a care worker, you can either work in a care home or in an elderly person's house or help in the community. You'll end up supporting people with their social and their physical requirements like eating and drinking, attending appointments, shopping and money management, undergoing basic medical checks, and washing and dressing. So the concept here is you basically work as a care professional and you work with the elderly or the people who need your help in some way or the other, who can't physically or mentally take care of themselves. You provide assistance and you provide help so that they can go about living their daily lives. Now, you're probably wondering what qualifications are required for you to do this job. And this is the absolute best part. This job does not require any formal qualifications. In this role, recruiters or employers usually prefer to hire somebody who is empathetic, who is compassionate, and who would like to help other people. Some organizations require a basic level of training. Some organizations require no training. And some organizations will help you get whatever training is required so you can improve your skill set. So if you want to move to the UK and you are basically a compassionate person and you are sympathetic and empathetic and you like helping other people, you can apply for the role of a carer or a caregiver in the UK because a lot of these jobs offer visa sponsorship. Now, in order to move to the UK under this job, you will require, just like the doctors and the nurses and the healthcare professionals, you will require a health and care worker visa. So let's break down what the eligibility criteria is for you to get this visa. In order to get this visa, you should be either a qualified doctor, a nurse, a healthcare professional, or an adult social care professional. You should work in an eligible health or social care job. You should work for a UK employer that has been approved by the Home Office. You should have a COS or a certificate of sponsorship from your employer with information about the role that you've been offered. You must also have a confirmed job offer before you apply for this visa. You should be paid a minimum salary, and how much depends on what type of work you do. And apart from this, you should also be able to speak, read, write, and understand English. You'll usually need to prove your knowledge of English when you apply. In terms of salary requirements, you must be paid at least £25,600 per year or £10.10 per hour to meet the minimum salary requirements for this route. Your minimum salary will be higher than this if the going rate for your role is higher. Each occupation code has its own going rate, and you must at least earn the going rate for your role. In some cases, you can still qualify for this visa if your salary is less than £25,600 per year, if your job is in the shortage occupation list, if you are either under the age of 26, a student, or a recent graduate, or you are in professional training, or if you have a STEM PhD qualification that's relevant to your job, or if you have a postdoctoral position in a scientific role. If any of the above apply, you can be paid between 70 to 90% of the going rate for your job, provided your salary is at least £20,480 per year. If you have a relevant PhD qualification, then your salary can be £23,040 a year. Now, how long can you stay in the UK under this visa? In most cases, you can stay for up to 5 years, and when your visa is due to expire, you can either update it or extend it, or you can change it if you want to change your employer. You can extend your visa for as many times as you want as long as you meet the eligibility criteria. And here's the other thing, after you complete 5 years on this visa, you are eligible to apply for an ILR, which is an indefinite leave to remain, which allows you to stay in the UK permanently after that. Now, coming to how much this visa is going to cost you. You and your partner or your children will need to pay the application fee. The application fee for up to 3 years is £247 per person. And if your visa is for longer than 3 years, it is £479 per person. You will also need to prove that you have enough personal savings to support yourself when you arrive in the UK. And you will usually need at least £1,270 in your bank account for at least 28 days consecutively. As with all visas, there's a bunch of things you can and can't do under this visa as well. Under this visa, this is what you can do. You can work in an eligible job, you can take on additional work, you can do voluntary work, you can study, you can bring your partner and your children as your dependents, you can travel abroad and return to the UK, and you can apply to settle permanently in the UK with an ILR if you've lived in the UK for 5 years continuously and meet the other eligibility requirements. Here's what you can't do. You can't apply for benefits like public funds or state pension. You also can't change jobs or your employer unless you update your visa. Now, I'm sure you're very excited about this and you absolutely want to know how you can apply for this visa. This is how. You must apply online for a health and care worker visa. You also need to have your fingerprints and your photograph taken at a visa application center to get your BRP or your biometric residence permit. In order to apply, you must also have the following documents. You should have your certificate of sponsorship reference number, which is something your employer will give you. You need to prove that you know English by taking the English language test. You will also need to have a valid passport that shows your identity. You will require your job title and the details of your annual salary. You will also require your job occupation code. You'll also need to provide the name of your employer and their sponsor license number, which will be mentioned on your certificate of sponsorship. Like we discussed earlier, you'll also have to show evidence that you have enough personal savings to support yourself in the UK, and you can show this by showing bank statements. If you're bringing your dependents along, you will need to show proof of your relationship with them, which is either your partner or your children if they're applying with you. If you're coming from a listed country and India falls in this, you will need to take a TB or a tuberculosis test. If you're working for certain jobs, you might even require a criminal record certificate. And if you're applying from outside the UK, you will need to apply through ECCTIS and provide a ECCTIS reference number. Now, I'm sure I've piqued your interest and you absolutely want to go and look for these openings, but here's the good news, I have some options ready for you. If you're interested in applying for the role of a care worker, I strongly suggest you check out this link. There are also some more companies which usually offer visa sponsorship for these roles. And here's a list of all of these companies. You can write into them, all of them, immediately and tell them that you're interested in these roles. Don't wait for an opening to pop up. There's the Loving Angels Care. There's HCA Healthcare. There's Midco Care. And there's Arms Care. Now, I know this is going to be a lot to take in, but don't be stressed. Simply follow the steps, and before you know it, you will have a visa sponsorship to work in the UK. Now, remember the shortage occupation list we were talking about earlier? If your role falls under the shortage occupation list, you can be paid lower than the going rate, which is absolutely great. Now, if you'd like to know more about the shortage occupation list, all you need to do is click on this video.